What's going on, guys? SAMOKFIT from SAMOKFIT, checking in with you guys. You guys are doing well, doing terrific. So in today's video, we are going to be talking about what I'm doing currently to fix my knee. Yes, I have a bum knee. If you watched the last video, you know exactly what I'm talking about. But if you don't worry, I'll put a link. You can check that video out. So today we are going to be going through the movements that I am doing to fix my knee. If you don't know, I am working with Dr. Aaron Horschig at Squire University. I'll put the little screenshot right here. If you don't know him, I mean, he is an awesome guy. He puts a lot of good content out there. So he's been taking over my physical therapy right now. I'm also seeing my doctor of chiropractic, Fleming, and he's been taking over like the chiropractic work. And like I said, I advise you to see a chiropractor from time to time just to, you bring your body up every day. So we need to make sure we take care of our body so we can come to the gym and perform every day. So I thought, you know what, maybe I should show you guys exactly what I'm doing right now to fix my knee, just in case you are watching this video and you're like, well, I can relate to what Sam is going through right now, and I would love to do what he's doing, so hopefully I can get better too, so we can get to the gym and we can keep crushing it. So I'll be taking you guys through that right now. And if you like this video, give it a thumbs up, and yeah, let's get to it. All right, so what you are looking at right now is one of my PT routines for my knee, right? So what I'm doing here is for my knee stability. It's gonna be a step down or single leg squat. So the purpose of this movement essentially is to make sure you are stabilizing your knee. And the goal of this movement is to start from like 2 inches and work your way up. And I'm doing about 2 sets of 20 repetitions on each leg. The next movement we are going to be doing is going to look a little bit different, a little bit weird. You might question it, but Sam, we're talking about your knee. But what you don't understand is a lot of times when you have a particular injury, it's not necessarily that injury that's causing the issue. The issue might be something else. So luckily for me, Dr. Aaron is a very smart guy, and he took a look at all the surrounding muscle groups around my knee, my hips, my ankle, just to make sure I have the right dorsiflexion to get into the squatting position. And in case you guys don't know, I also have a lower back injury. Yes, I am broken, I know that. That's why we're trying to get fixed. So the movement that we went through is pretty much going through a squatting motion. And if you can see on the screen here, the squatting motion that I'm getting into, you can see I am dipping a little bit to the left. And what that's telling me or him is I am running out of room on my right, so I'm compensating by dipping on the left. So this routine that was put in place was for me to open up my hip. And this routine is gonna be kneeling down with a kettlebell in front of you and just sliding to the left. What the cues that you want to pay attention to when you perform this movement is you want to make sure, one, you're externally rotating your hip outside, flexing your glutes, and gliding towards the knee that's not bended. And I typically repeat this for about 15 repetitions for 3 to 4 sets. I do this on both sides. So fast forwarding and moving to my lower back injury, right? Anytime you have a QL injury, of course, a lot of times, maybe not so certain for you guys, it's a lot of core issues, right? Because your core is not strong enough, then other parts are compensating for that. And the big movements that hopefully you know, hopefully you're doing, hopefully you are aware of is called the McGill Big 3. The McGill Big 3 essentially is the curl up, the bird dog, and the side plank. The first movement you are gonna see is the curl up. The way you perform the curl up essentially is you put your hands behind your back just to make sure you're nice and stable. One leg is bended just to create a little bit more leverage in your lower back, and you wanna fill your diaphragm with air. Slightly bring your head up a little bit, and you wanna perform what I call straw breathing. You wanna hold this for about 10 seconds and repeat for about 10 repetitions, 2 sets, and that should be good for the day. The next movement is gonna be side plank. It's not complicated, just get in the plank position, hold that for about 10 seconds, and then you move on to the next one, which is gonna be the bird dog. The key with the bird dog movement is you wanna make sure your trunk is not shifting. And you wanna make sure you have a nice tension when you stretch your arm out, and a nice tension when your leg is kicked back. And again, the key is you wanna make sure your trunk or your hip is stable. And what you wanna do is bring that arm up, touching your knee, create a nice little trunk stability, and you wanna repeat that 10 repetitions on both sides. All right, so that's my current PT program that I'm doing right now. Again, huge shout out to Dr. Aaron Horschig from Squire University for putting the program together for me. I've learned a lot working with him, and I'll continue to learn a lot. I'm seeing him once a week right now, and hopefully this video has helped somebody out. If you are hurting, seek help. I tried to navigate through my problems, self-diagnose myself a little bit. I'm like, no, I need help, because I want to get back to moving better. I want to get back to performing at my best. And for me to do that, I need to seek out help. But I was very fortunate that Dr. Herring is very close by, and my chiropractor, Dr. Fleming, is very close by. They can take care of me just to make sure I'm back in the gym performing at my best. We all want to get to the gym, crush it all the time. So make sure you're doing the small, tiny little things to make sure you're preparing yourself better. Mobility is important. Make sure you're properly fueled. You warmed up properly before you get into your training session, so you won't end up getting hurt, because you won't want to get to the gym and just keep making that gains. Anyways, this is Sam Canol from SAMOKFIT. I appreciate you tuning into this video, and I'll see you in the next one. Peace. Thank you for watching this video. If you like this video, comment, like, subscribe, and share with your friends.